Thank you very much, Chairman Tester, and really appreciate being here as with you as our new chairman. And I want to say I want to completely identify with the frustration of the chair and the passion that he spoke about in terms of the budgets and looking at these charts. I mean, he's outlined something, and I would just adopt his comments. I would, in addition, point out, and this, it's been absolutely devastating, the long-term effects sequestration have had on Indian country. Dr. Rubidoux, the IHS was the only direct medical service agency that was subject to full sequestration cuts. Medicare, Medicaid, Children's Health Insurance, Veterans Affairs, all were either exempt or received a smaller cut of 2%. And according to your testimony in April 2013, you estimated that the reduction would include 3,000 inpatient admissions, 804 outpatient visits. This was a painful, unnecessary, arbitrary cut to communities that can ill afford them. And so I'm not going to go on and on. I'm going to put this statement in the record because I want to ask you questions on BIE. But it's important we get the figures out there. BIE schools lost $42.2 million as a result of sequestration. This had to be absorbed by 183 already underfunded schools. Tribal Head Start programs lost $11.9 million as a result of sequestration, impacting 25,000 children in 26 states. The Bureau of Indian Affairs Office of Public Safety had an $18.3 million sequestration cut, and I could go on. And I know you both know this and understand this very well. And I would be interested as we proceed in the hearing how these cuts are going to affect us in terms of moving forward. But let me ask a couple of questions here. Dr. Rubidoux, I appreciated your testimony about the work that the Indian Health Service is doing to address outstanding claims for contract support costs. And as you noted, these have real impacts on tribes, including tribes in New Mexico. However, while you have reported considerable progress overall, your agency has stated that of the 93 claims, 0 have been settled and 81 are still pending. What will you do to work with me and the committee to ensure that tribes receive the settlements they're entitled to?
Well, we're absolutely committed to working with you to try to resolve these past claims for contract support costs as quickly as possible, and so we'd love to work with you on that. If you look at the claims in New Mexico, I think since we sent you information, I think in my inbox, a settlement offer to one of the tribes popped up, and I approved it. So we'll see how that negotiation goes. We've also completed 4 analyses and have 15 claims on the priority list for New Mexico. So we are working very hard. We know that tribes need this funding. They know it's owed to them, and we want to work very hard to resolve these claims. So we're working very hard. The numbers are changing on a daily basis, so I'm glad to be able to give you a little update.
Okay, well, I hope you'll update us and keep us apprised, because as you have said, I mean, these contract support costs are absolutely crucial for self-determination and for the tribes to be able to move forward with the things that they believe are important to them. We have an Indian center, Dr. Rubidoux, in Gallup, called the Gallup Indian Medical Center. It's long been on the list. It's a facility that needs to be renovated, if not replaced. At this time, how's the IHS thinking creatively to advance the management of facilities and construction to update, improve, or replace these outdated facilities? And what other sources of funding, what greater use of telehealth or emerging models of care are you contemplating to address this concern now and in the future?
Well, we're absolutely trying to do everything we can to address the health facility construction needs in Indian country, and they're enormous. The current priority list, which Gallup Indian Medical Center is on, has $2.1 billion left of construction on it. And in addition to our president's budget, the Opportunity, Security, and Growth Initiative has the $200 million increase for health facilities construction. So we do hope that that gets good consideration. You know, we do a lot of creative things. The average age of our facilities is 20 to 30 years, and so we do things like save up on our third-party collections. Gallup Indian Medical Center was very innovative and was able to build an entire outpatient center doing that. We look at leasing space. We look at other innovative things like modular construction, look at what kinds of repairs that we can make. Telehealth is an area that really does help us expand services without having to do construction, and New Mexico is a lead in that with several programs that are happening that help get services to rural areas. And in terms of delivery models, I think that there's a lot of change with the changing healthcare delivery system, and we're working on our Improving Patient Care initiative, which is looking at reorganizing the clinic to make sure patients' waiting times go down and there's more availability of appointments and a more of a team approach to care, and that involves in some cases reorganizing the actual space in the clinic to be more efficient. So we are working on some of those things, and but we know funding is the quicker answer, and we're also working on that as well.
Thank you. Assistant Secretary Washburn, you heard me talk a little bit about the impacts of sequestration. I mean, moving forward and coming up with your budget, what are you trying to do to, as best you can, fill the holes and make a difference in terms of what the cuts that have happened and how we're going to move forward to deal with what's happened in the past?
Thank you, Senator Udall. You know, you're right. A lot of the tribes are still feeling the sequestration because we didn't backfill the 5% that got cut. We first of all, we paid full contract support costs in the 2014 year when we did get funding, and so we couldn't have backfilled the 5% because we had the other purposes for that money suddenly. And we did a few other things that we felt were important in the law enforcement area, a little bit in education. We're doing the best we can, and tribes are frustrated and struggling, honestly. We're in tight fiscal times, and as long as we are in tight fiscal times, it's going to be hard to get out of this. We have to, you know, hopefully with the economy improving, you know, we won't get another sequestration. We will get past the Murray-Ryan budget caps and go back to sort of regular order where we can ask for what we need rather than trying to fit into really tight caps. We're working hard on that, and we know I've just come out of 2 days of budget meetings with tribes, and so they are really feeling the pinch, and I hear you.
Yeah, no, thank you very much. And I know you're both working very hard to try to remedy some of this. Thank you. Yield back.